Here's my speaking outline for the informative speech for my communications class 111. I also have my displays here of a first aid kit along with our AED, and luckily today we're joined by almost my entire paramedic class. Say hi, class. Ready? Thanks. 2 weeks ago started out just like any other day for a normal office worker. He was getting ready to go to his afternoon meeting when he stood up from his desk and turned to his coworker and he said, "I don't feel so well." Suddenly collapsed onto the floor. Without hesitation, the coworker ran downstairs and activated the company's first aid program. Trained personnel were able to come to his side and start rendering care while 911 was en route to the scene or to the company's business. By the time I arrived on location, the man had had CPR performed and was successfully resuscitated and conscious and breathing as we began to stabilize him to transport him to the hospital. In my 17 years of EMS, I've seen these calls go horribly wrong when people don't know what to do and are untrained in these situations. But by having a in-house or an in the workplace, first aid program, the outcome for this patient was very good. And today we're going to talk about some of the ways you can establish a first aid program in the workplace. Accidents happen every day. OSHA estimates that over 4 to 5 million people get injured at work every year. And of those, almost 100,000 result in some sort of mortality. The patient actually dies, or morbidity. They have an injury that actually renders them incapable of returning back to work. When we look at the injuries that occur, normally we think of the simple things, sprains and strains, lacerations, maybe a simple paper cut, but sometimes they're as serious as an explosion or electrocution. Many times we get called for falls off of something as simple as a ladder, off of a chair when someone goes to get something off of the top of the shelf, or sometimes they may actually fall down a flight of stairs, or even worse. Therefore, it's necessary to have a first aid program in the workplace to help prevent these accidents. Normally, prevention is one of the best training tips that you can provide someone in establishing a first aid program, by making sure that rugs are laying flat, extension cords are not overextended, or perhaps making sure that ladders are in place properly, and that the ladders are secured when they are not in use, and that they are sitting flat when they are in use, are some of the best ways to help prevent injuries. But sometimes prevention isn't enough, and you do need some training. Online training is available through programs such as the American Heart Association, the Occupational Safety and Health Administration, or OSHA, as well as NIMS, which is the National Institute of Management of Safety. They will go ahead and provide training in 25 to 30-minute segments online. Then you can take those training segments from online and convert them into hands-on training for your workplace, which studies have proven that hands-on is normally the best way to practice any skills that you have learned. As you all know from the training that we do here, we can sit here and talk about it all day, but until you actually put those skills into play, they sometimes don't mean a whole lot. Training is very beneficial. We can train all the time. We train to be prepared. As you know from your career and your jobs, that some of the best prevention is training, and by training we're ready to go at all times. However, you still need the skills and supplies necessary to effectively apply that training when the time occurs. Some cheap, easy fixes for supplies. First of all is having a phone handy. We all carry cell phones on us. Some carry two, some sort of radio or communication device. But having a phone to being able to access 911 is one of the first steps of a first aid program and applying the training. Next thing you might want to do is get a piece of pen and paper handy as you're going to take care of the injured person. That way you can jot down any information you may need. The person's name, their address, their birthday, any significant medical history they may have already, any medications they may take, allergies, or if this incident has happened before. If it's a traumatic injury, such as a fall, laceration, electrocution, hopefully obviously it hasn't happened before, but if it is a medical emergency, have they had chest pain before? Have they had respiratory distress or shortness of breath? And again, do they take medication for that? Band-Aids, cold packs, aspirin, they all fall in the category of cheap or less expensive first aid kits. I'm sure we all have those around the house. Sometimes more appropriately, a first aid bag such as this, where on the inside we have larger compartments that would have medications for diabetic emergencies, medications to treat any kind of allergic reaction, as well as bleeding and bandaging control supplies in here, and vital sign equipment, blood pressure, stethoscope, etc. On the outside of this, we keep what's known as a bag valve mask. This is to provide ventilations for someone who may not be breathing properly. These fall in the mainly moderate category of cost for first aid supplies. When we look at spending a little bit more effort and a little bit more cost, normally this involves the corporate level of management for any business, we start talking about an AED. And this is an actual electronic device, very simple to set up. It only has 2 function buttons. The first one turns it on, and the other button actually delivers the electrical shock. Over here on these 2 pads, you'll notice that they are set up in such a way to show exact placement, and realistically could be applied by anyone in the workplace, not just the person trained for them. Nowadays you'll find these in shopping centers, malls, police cars have them because they are so efficient at providing first aid, and we do come across them in many workplace and work environments as well. So when we look at the necessity of having a workplace first aid program, we can see that it is very important. With just some simple training, online programs, as well as practicing your skills, either on a mannequin or in a formal training session such as this one, minimal supplies, you can effectively coordinate and execute a first aid program within the workplace. Thank you very much for joining me.